Hi, today I'm going to talking about the calorie restrict diet for the patient after surgery. So it's have the four phase. So the first phase is gonna be the clear liquid diet. So the clear liquid diet is gonna be the duration is gonna be 1 to 2 days after surgery. So what is this? It's gonna be the clear liquid fat, like it's the watery if that can see through of that, so without the meat constituents. Recommend the curated for the set example like the herbal juice, the vegetable juice that have no fiber. You need to clear that is have no fiber because it's the patient very like uncomfortable of their digestive system. So you need to add the you can add this diluted fruit juice, can be like and jelly blended like have no sugar, so you can be like this. And the 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 amount of the food is gonna be like 1.5 to 2 liters for per day. So the next is the second phase. What is the second phase called? It's gonna call like full liquid diet. Full liquid diet, what does this mean? Duration of this phase is gonna be like 3 till 14 days after surgery. So what is this? It's gonna be the water, but you can be the cloudy water. I means like the county water is being like the it's being like the liquid, but you can add a little bit something, the protein, the skim milk and maybe soy milk and maybe yogurt, the low fat, very low fat, not to add the sugar maybe. And the porridge and the fruit juice can be like that, and putting that blended and the protein powder mixed with the water, it can be like that. Okay, so the amount of that is gonna be same as the first phase. Okay, so the next I'm gonna talking about the third phase. What is the third phase is? The third phase is duration of the third phase is like a 14 till 28 day after surgery. So it's called puri diet. Puri diet, what is this? Is the volume of the liquid include water like for 1.5 to 2 liters per day, and 3 main meal small at the small portion, and the snack like 2 to 3 snacks per day. So and maybe recommend the protein intakes like for like 80 to 60 to 80 grams per day. So the thick meat dish can be added, and it's gonna be the viscose food. Maybe it's gonna be the viscose food. The viscose food is can be the mashed potato that's very blended, and then you add it and yogurt, and can be like the thickness soup can be like add and scrambled egg, that's very like the smooth and the soft tofu, the blended foods, and mixing cooked ingredients such as the fish, such as the eggs, such as vegetable and fruit, but you need to blend it. If the patient can be unconscious, if the patient is unconscious, you need to blend it all the time. But the patient can have a consciousness, you need to like give the patient just a scrambled egg, something like this. It can be. So the first phase is, what is this? The first phase is the soft diet. Soft diet. The duration is the 5 weeks after surgery. 5 week after surgery is gonna be the amount of food that we give the patient is gonna be the same. So like the water is gonna be like 1.5 to 2 liters per day, and 3 main meal like breakfast, lunch, and dinner, something like this, and can be the recommend protein intake like 60 to 80 per gram per day. So the soft food is normal food. Is a normal food, easy to chew, easy to swallow, easy to digest for the patient that consciousness. But the patient that have unconscious, you need to be the blended all the time because they can't. And then but the digestive system is already relieved, but so you can use the food that a little bit like have the nutrient, not like a soft. Okay, so this one is gonna such as the food is normal, but not to be like extend that is smoothie or liquid food, but can swallow but easy to digest, something like this, like fish fillets and brown rice and maybe the whole wheat bread and skim milk and yogurt, maybe add sugar, but not fat, not it need to be the low fat. So the vegetable and fruit be can easily to chew if the patient consciousness, but unconscious you need to blend it first. uh, so we need to avoid the high energy fat and sugary food and focus on the high protein, because the high protein is gonna be the building about the system that can be the okay here, you know. Okay, so it can begin to cook and scramble using less oil, this fats, you know, and chewing food well, thoroughly and slowly. If you feel full, stop eating immediately. If you consciousness, but if you unconscious, the nurse or maybe the doctor is gonna be determined about your food. Okay, so the example is gonna be the fish, something like brown rice, the whole wheat that I already said. So, but everything need to be have no very like strong taste, you know, because you after surgery, after 5 weeks, you can be like do anything. So, thank you for today.